from a song that I heard um, that really emotionally touched me at feelings. Now we can get on to the presentation. How my mom saw me from the age, from when I was born until the age of 6 is I was a normal child, normal activities, played soccer, I hiked, I biked, went to church, all around your typical kid. Judging on the brain, which is what pretty much this presentation is about traumatic brain injury and mental illness, which I'll emphasize more on later. This is a scan of a healthy brain. I have this done at the Inman Clinic in Reston, Virginia. Notice this one, smooth, there's no jagged edges, there's no pockets or rough edges around this, or drop-offs. Everything's nice and smooth. The activity of it is this is your basal ganglia, the back side of your brain, which is your more or less your balance. And when you're laying flat on your back in this machine, you rely on your balance so you don't move for 17 minutes. The red indicates little activity, and the white shows high sources of activity. October 7th, 1982, I was in a car accident. My mom and I just got done going grocery shopping. My sister's in the front passenger seat. My mom was driving. We were on our way home. I was tired. I laid down in the back seat with my head on the armrest, doing about 35 miles per hour. We went through a traffic light. Someone turned left in a no-turn lane, hit us, causing the car to spin violently. When they hit us, I went from stationary to a forward motion, which caused a tricky words, depressed fractured skull, sorry. Which the window knob actually broke loose, and the bolt that holds it went straight into my skull. With my skull open, I landed on the floor. When the car stopped spinning, my mom asked my sister, how is your son doing? How's your brother doing? And she looked in the back seat, and she said, he's not moving, there's blood everywhere, he's not doing good. The people who hit us, the driver didn't have a driver's license, no proof of insurance. The passenger had open bottle, had proof of insurance, no driver's license, and we went after both of them and the father, and the net worth was quite a lot after the court hearing. Knowing what they know today, it'd probably be 3-4 times as much, but back then, neurology was not something that they knew a lot about. So, luckily, there was an ambulance nearby, and they arrived 2 minutes after the car accident. They immediately loaded me into the ambulance. I was in a coma. They put me on life support. They transferred me to a hospital, which was 10 minutes away. They couldn't do anything with me. I was in the hospital for about a week and a half, and they put a pressure gauge on the back of my head. They irrigated the wounds. They put me on life support. They couldn't do anything because it was an adult hospital as a child. So, they had to transfer me to Children's Hospital, but the critical part of this is they had to transport me ICU. They had me hooked up to life support. When you're being transported in an ambulance, it's very risky, and the chance of living is slim to none. They told my mom, your son has a 0.10% chance of living. If he does live, he'll be considered a vegetable. So she had to hear that before the transport. They transported me to Children's Hospital, where immediately they had to do the craniotomy, where they cut from top of one ear to the top of the other ear. They peel the skin forward, they pull the skull back, they actually cut down the sides of your cranium, cut over and peel it open. They had to grind out the hole, they had to remove all the bone fragments. But before they did any of this, they had to tell my mom, your son has a 0.10% chance of living. If he does, he'll be a vegetable. As the craniotomy continued, they irrigated it, they scrambled my left frontal lobe. Went back, I was in a coma for about 2 weeks. In that amount of time, they did, when I came out of the coma, they did 2 spinal taps on me. They had to remove 2 scent glands in my nose and in my mouth. Again, they gave me a 0.10% chance of living. If I did, I'd be considered a vegetable. They did surgery for eye muscle repair in my left eye. My mom and my sister, after getting out of the hospital, had to remove, it's like refrigerator tape on skin, put it over a scar and peel it off. It was excruciating pain when they had to take this off. I had a radioactive MRI. They did exploratory surgery due to how much food I was digesting. You have to understand, I weighed 90 pounds. I lost a third of my body weight, so I weighed 60 pounds. You can see all my vital organs through my skin. Everything was sunken in. It was scary. They did exploratory surgery. They found a blood clot in my left hip. They gave me a shot of heparin, and they made me lay on my back for 2 weeks, which was not fun for my mom. I was on a ventilator for 7 to 10 days, and anybody knows anything about ventilators, if you're on a ventilator for 7 days, the chances of living is 0. You usually don't come off of it. When you say 7 to 10 days, it just doesn't happen often. After everything was said and done, I was in the hospital for 2 months. I went back home. I was so weak that I could not walk. And my mom tucked me in bed one night, and the night I got home, and she got up the next morning to check on me and see how I was doing, and I wasn't in my bed. I went to the other side of the ranch to watch cartoons, and they had no idea how I got there, because they had to help me back to bed. But
I wanted to see your cartoon.
That's pretty much that. I was in an ICU unit for about 3 or 4 weeks. Had a lot of problems with neurologists saying, this is the way it is and that's that. You have to do what you have. You know, we get secondary opinions, of course, but things were difficult. When I got home my birthday, which is December 23rd. This is what I looked like. Now, right here You're gonna see the eyebrow is higher, the eye is lazy, cheek swollen, missing both of my canine teeth, and right here you can actually tell, because there's a part on both sides of where they did the surgery. And it totally shifted my skull down on the left side and left it normal on the right side. It was a hard birthday for me. Showed you the healthy version of the brain. This is my version of the brain. Right here should jump out at you. No left frontal lobe. General damage to the temporal lobe. Right here, all these little divots are from bike accidents, head injuries that I had playing sports. Right here's another one. All of this executive functioning, in the age of 7, that's when all your neural pathways stop and they're routing themselves, and they reroute in a different direction. I'll get to that on the later scan. But this, on the bottom side, is scalping and toxicity. Notice there's a big ledge right here. There's a rough area through here. That is from drugs, alcohol, fumes, anything that's, can be considered dangerous, or a substance will do that to the bottom part of your skull, the brain. I have a scan here for you to read that's...
Sorry.
Thank you. I have a scan here for you to read about what the left frontal lobe does, what its functioning is, and how it works with your body. It's executive function. Reading that and spending time with me, you actually wonder how it can actually be. I'll explain that on the next one. So, this is it. This right here is the cerebellum. The huge white clusters are making up for the left frontal lobe. Everything that was in the left frontal lobe went to the cerebellum balance. So that's the reason why I have the high activities. Right here, this little area of red with the white is your basal ganglia. That's your anxiety. I had tons of anxiety when they did the scan, because it's a triangle that you have to stick your head in that revolves around slowly. Claustrophobic. Anybody familiar with Xanax? It took me 4.5 milligrams of Xanax to get through it. It was rough. But this is it. And here's a picture of before and after, kind of comparison. My head's more full and rounded in this one than in this one. Lazy eye, loss of canines, still had swelling on the cheek. This is probably about 9 months after it happened.